Let's talk about something you've probably seen popping up everywhere, the freestanding ER. It's a growing and, frankly, pretty confusing part of our healthcare system, and what you don't know about it could literally cost you thousands. I mean, you know what I'm talking about, right? You're driving to get groceries, and boom, there it is, an emergency room, tucked right into a shopping plaza. It looks super convenient, sure, but there's a whole story behind those glass doors that you really need to hear. And get this, that's not just some random comment. That's a direct quote from an ER doctor, someone who actually works in the system. It's a pretty serious warning. So what do they know that the rest of us don't? Okay, let's pull back the curtain and figure this out. What exactly are these places, and how do they really work? So the official term is Freestanding Emergency Department, or FSED. Now, they are licensed as real emergency rooms, but here's the key. They are not physically attached to a hospital. And that one little detail, well, it changes everything. So here's the heart of the issue. You walk into one of these places and it feels like a really nice urgent care clinic, right? And for a lot of common stuff, it basically is. But here's the trap. It doesn't bill like an urgent care. It bills like a full-on hospital ER. That means you're getting hit with massive facility fees and way higher costs, even for something simple. And if you think that's an accident, it's not. Listen to this ER doc. They're saying it's an intentional strategy. You give people the convenience of an urgent care, but you charge them the massive prices of a hospital ER. This whole setup created the perfect conditions for a huge problem. Yeah, this business model leads directly to a massive financial nightmare for patients who have no idea what they're walking into. Let's break down exactly how that trap is sprung. All right, a quick refresher, just so we're all on the same page. In-network is pretty simple, right? It just means your doctor and your insurance company have a deal. They've already agreed on the prices. Out-of-network, on the other hand, that's the Wild West. The provider has zero contract with your insurer, which means they can charge whatever price they want. And your insurance? They're only going to cover a tiny piece of that, if they cover it at all. And that is where the surprise bill comes from. It's the gap, that huge difference between the crazy price the out-of-network doctor charges and the little bit your insurance is willing to pay. That difference is called balance billing, and that balance, it gets billed directly to you. It can be absolutely devastating. And this wasn't some rare thing happening to a few unlucky people. Before the law changed, studies showed that about 1 out of every 5 visits to the emergency room resulted in one of these nasty surprise bills. 1 in 5. The problem got so big, so completely out of control, that Congress was pretty much forced to do something about it. And they did, with a huge piece of legislation. It's called the No Surprises Act. The whole point of this law was simple: to take you, the patient, completely out of the middle of these ugly billing fights between doctors and insurance companies. So here's the protection the law built for you. Now, if you go to an ER, any ER, you are only responsible for your normal in-network costs. Your regular copay, your deductible, and that's it. The out-of-network doctor and your insurance company, they have to go fight it out behind the scenes to settle the rest of the bill. You are legally protected from that fight. And honestly, on that one primary mission, the law has been a huge success. One estimate says the No Surprises Act is preventing around 10 million of these surprise bills every single year. But, as you can probably guess, the story doesn't stop there. Because when you fix one problem in a system as complicated as healthcare, well, you almost always end up creating a few new ones. So the law created a whole new process for those fights I mentioned. When the doctor and the insurer just can't agree on a fair price, the case goes into a new federal dispute resolution system. You can basically think of it as a special court just for medical bills. And this is where things went completely off the rails. The government figured the system would handle maybe 17,000 disputes a year. The reality? In 2023 alone, almost 680,000 cases were filed. The system was completely buried from day one. So, from the doctor's point of view, this new system is a total disaster. They describe it as a bureaucratic nightmare. It's chaotic, and it's got these massive backlogs. It means they're not getting paid for months, or sometimes even longer, for care they already provided. But then you go ask the insurance companies, and they tell a totally different story. They argue that some really big physician groups are gaming the system, just flooding it with disputes to try and squeeze higher payments out of them. So you've got this huge, expensive, totally overwhelmed system where two of the most powerful sides of the healthcare industry are just duking it out over billions of dollars. Which leads to the one question that always comes up. We do. At the end of the day, experts are warning that all the costs of running this broken arbitration system, plus any higher payments that come out of it, are probably going to get passed down to all of us in the form of higher health insurance premiums. So let's wrap this all up. What does this actually mean for you when you're making a split-second decision about where to get medical care? Here are the big takeaways. Number one, never forget, freestanding ERs bill like hospitals, not urgent care. It's a huge difference. Two, even though the law has your back in an emergency, for anything else, it is still a really good habit to just ask, are you in my network? The good news is, you're now protected from most of those financially crippling surprise emergency bills. But the bad news? The underlying war over healthcare cost is still raging on, just behind a curtain, and it could be showing up in your monthly premium. So look, the No Surprises Act did exactly what it set out to do. It moved you, the patient, out of the direct line of fire. But it leaves us with this big, nagging question. In a system this complex and this expensive, when you solve a problem for one person, are you just shifting the cost somewhere else, leaving all of us to slowly, quietly foot the bill?